Hello there. Good afternoon, everybody. Today is Monday, May 11th, 2020, and this is my community update in regards to COVID-19. First of all, I just want to take a minute and send my thoughts and my condolences to any families within the community that may have experienced a loss recently. My heart sincerely goes out to you, and it's always a hard time to lose anybody, and in particular during a pandemic, I'm sure it's much more difficult not being able to be together and be with family and grieve together. So just a reminder out there how important it is to maintain that physical distancing and make sure we limit the spread of this virus. In Lambton County, there's 200 cases of COVID-19. There are 142 recoveries and 17 deaths. And I wanted to come on here today and be happy and happy-go-lucky and say that we got everything under control and we know what's going on. And I'm just feeling a bit at loss today. I'm going to be totally candid. Struggling a bit today and just thinking about what's going on. We have made some initiatives in the First Nation with the community control group to move our checkpoints from where they were on London Road and Indian Lane to West Ipperwash, and share pamphlets, and that went over without a hitch. Everything is going good. Sharing information. We're going to be taking door to door to each cottage a list of all the community restrictions, and that's going to be done in coordination with our Anishinaabeg Police Services. There's still a number of BCRs in effect, a number of laws that are enforceable, and travel to the First Nation is still restricted. Not physically anymore by somebody stopping you from coming in, but by police following up and having people leave that have come here without the need for essential activities. On our website, www.kellerpoint.org, there are a list of essential activities and essential travel needs, so that is there, and that seemed to go very well, and I was feeling good about that. Shortly after that, I received a phone call that there's one more confirmed case of COVID-19 within our community. So I just want to talk a bit about that. We've had 4 total cases within our boundaries that have been confirmed. There's likely more. Medical professionals are telling us that there likely is and were more cases within our boundaries over the last month or so, but 4 confirmed cases within our boundaries here at the First Nation. That means that as individuals, we're not taking this seriously enough. You cannot rely on somebody with a stop sign from keeping the virus from getting to you. The responsibility is on you. The responsibility is on you to stay home. The responsibility is on you to wash your hands and not touch your face by touching your eyes, your nose, or your mouth. And the responsibility is on you for making sure you're careful with who you have in your home, who you have in your vehicle, and places you go, the places you frequent. Having house parties, having people over to your home, traveling all over the place and not taking care of yourself is putting yourself at risk. And myself too, I had to be more careful. We've had a number of emergency calls in the First Nation over this pandemic. We've had no structure fires really to speak of in the last number of years. We've had 3 structure fires during the pandemic, and we've had a number of medical assist calls during the pandemic. And I'm still a volunteer in our fire department, and even myself being out in those calls have put myself at great risk, and doing my best to keep physical distancing. I'm very concerned today. The fact that we have more COVID-19 within the community, despite having checkpoints up, despite limiting outsiders from coming to the community. COVID has penetrated the veil, so to speak. I think that we have limited the spread into the community, and we've flattened the curve, and that's been done, greatly by also those outside that are protecting us as well by putting in rules and regulations and limiting travel. But the onus falls on us as individuals. It falls greatly on us as individuals to make sure that we're not jeopardizing our own health and jeopardizing those around us. The person who tested positive recently is asymptomatic. They had no symptoms. They were tested due to a physical interaction they had with another individual, and that ended up resulting in a positive test. asymptomatic. That means that there's people in the community that have no symptoms that are likely positive for COVID-19. So I'm not panicked, but I'm a little bit disheartened. I feel like I don't have the control that I'd like to have in regards to my life and in regards to this community around this virus. And that's a difficult way to feel, and it leads to a lot of feelings. And I understand that many people feel like they don't have control in their life right now because the world's a different place. So we're going to have to, as individuals, take this really seriously. Take very seriously what you do right now in your life, who you interact with, where you go, and how you care for yourself. So that's my solemn message today. I'm very, I wish I could be cheery and happy, but the wind is out of my sails today. I'm really disheartened that this is going on, and that we have to do contact tracing. The benefit is, though, is that we do have a testing center here in the First Nation, that we are able to get results back very quickly. And it was because of that, the testing center that we have, that we got results back so quickly for this individual, and we're able to help do the contact tracing. So if this individual was in contact with you, the Lambton Public Health will reach out to you and have a discussion with you and begin that process with you of testing you and seeing what's out there for you in terms of your contact with everybody else, that contact tracing bit. So that's my message today. I still no need to panic, but it's very important that we take this seriously. The threat is real, and again, we're in for the long haul. So let's focus on that. Let's be safe now so that we can shorten the amount of time that we're stuck in this. So nobody else is going to keep you safe but yourself. So don't panic, eat bannock, and wash your hands, man.